Hello, this is Dr. Ali Hadwani, and today we will be discussing stroke awareness. Again, before we start, the seminar is completely for educational purposes. It's not meant to be used as a modality to self-treat oneself. However, it's to give that education and that understanding of what strokes are, and also give the treatment options available so that you may discuss the appropriate treatment with your family doctor. So let's get started. We'll talk a little bit about what a stroke is. Stroke basically affects the brain due to a lack of blood flow for many reasons. Either there's a blockage or there is a bleed that occurs in the brain that leads to the tissue beyond that area to be damaged. So we'll talk a little bit about certain statistics of stroke within the general population, define what a stroke is, identify signs and symptoms that may be prevalent in a stroke, discuss causes, risk factors, and diagnose and treat these individuals and what treatment modalities are available. Let's get started. So there are two main types of stroke. One is a hemorrhagic stroke, or for simplistic purposes, we're going to just call this a bleeding stroke. And there is another called an ischemic stroke, or we'll talk about that as the blood vessel is completely clotted off. So that type of stroke. And as you can draw some parallels from the high blood pressure seminar done previously, that for example, this is the water hose example we talked about for high blood pressure, where this area was connected to the house, and this area is connected to your garden or your grass that you need to water. So if someone were to stand on this water hose, there would be an increase in pressure here, an increase in so much that it may burst, have a significant higher amount of pressure and burst, causing a bleed in a specific area. And this bleed also prevents blood flow going to further tissue, and that ends up dying off, which is what happens in stroke. The other scenario is that, again, here is the water hose connected to the house, and this is what's watering your garden. So if there was a complete, let's say an individual who was very, very heavy and stood on this water hose, possibly there would be a point to where no water would go beyond that, and all that garden or grass would die off because it's not getting the water and nutrients from the water source itself. Similarly, in a blood vessel in the brain, for example, if there's a clot that completely obstructs the center of this tube, no blood would be able to get across, and the tissue behind that would die off because it's not getting its nutrients and other oxygen and whatnot in the blood. So let's define what a stroke is. So stroke is basically a sudden onset of brain damage due to an interruption of blood flow to a specific area of the brain. There are two main causes: a lack of blood flow, which is this specific case where there's a clot that prevents any blood flow from going through, and it can be caused by a variety of issues such as a plaque formation there. It can be caused by a clot breaking off from elsewhere in the body and lodging in the brain blood vessels and completely obstructing blood flow to certain areas. Also, it can occur in case of heart failure, that the heart is not pumping enough blood to specific areas of the brain, and if it doesn't get enough nutrients, it can die off. 20% of strokes are due to brain bleeds, as we talked about here, where the pressure increases to a certain high point to where this area of the blood vessel bursts and causes bleeding in the brain, and a lack of blood flow to the adjacent part after the insult to the blood vessel is not getting enough blood flow. So the causes of these are basically having high blood pressure or hypertension, small blebs from blood vessels that break off, and some of these can be even genetic in nature. And what's interesting actually is that these lack of blood flow strokes, about 20 to 40% of them can transform into a bleeding stroke within 1 week afterwards. So that's why follow-up is very, very important after an individual experiences a stroke. So let's talk about certain risk factors. Things that we can't change. Unfortunately, we cannot change our age. Men have a significantly higher risk than women. However, once women reach a postmenopausal time frame, then the risk becomes fairly equal. Being of African ancestry, having a positive family history of strokes, having a history of having a heart attack, stroke, even a history of migraines. And the reason of a history of migraines is because one of the potential causes of migraines are that the brain is not getting enough blood flow and oxygen, and thus those who have migraines tend to be known to have lesser amounts of oxygen within their brain, thus leading to potentially a stroke. Sickle cell anemia can cause strokes, or is a risk factor for strokes. Certain genetic issues and these brain aneurysms, which are basically the blebs we talked about in the blood vessel itself. Things that we can change, however, having high blood pressure, high cholesterol, high blood sugar as in diabetes, certain blood clotting disorders if it's treated, same thing with sleep apnea. And what's interesting about sleep apnea is that you have a 3 to 6 times increased risk of getting a stroke if you do have this. That's why treatments are very important for these disorders. Heart disease, smoking, particularly smoking with and also being on a birth control or oral contraceptive pill puts you at a higher risk. Alcohol use, obesity, sedentary lifestyle, which basically means an inactive lifestyle. Having chronic stress, pregnancy can also predispose to strokes, trauma, and chronic inflammation. So what are the symptoms of a stroke? And I think that this is a key point that I would like each individual watching this segment to understand and be able to ascertain when a stroke is happening in an individual. So to spot a stroke, use the mnemonic FAST, F-A-S-T. F for face drooping. So as you can see, if you ask this individual to smile, one side is working and the other side is not working at all, and you can notice some weakness there. If you ask the person to raise both arms, for example, perhaps this arm doesn't raise as much as the other one does. So that can lead to arm weakness as part of a stroke, as part of the stroke symptoms. Speech difficulty is very important. So they'll have a sudden onset of slurring of their speech or not able to talk. So these three symptoms here, or signs rather, are indications that possibly this individual is having a stroke. And what you should remember is T then is that it's time to call 911. So it's very important to understand these symptoms or signs right here. So face drooping, arm weakness, speech difficulty. If you see any of those present that are a sudden onset, it's time to call 911. And it's usually on one side of the body, not both sides, as strokes usually affect one side most commonly. Other symptoms that one may experience may be a sudden severe headache, sudden loss of vision, for example, in one eye, sudden problems walking or gait problems, falls, loss of consciousness, nausea or vomiting. So these are some general things that may occur, but mostly we're looking for this FAST mnemonic here. Okay, so face drooping, arm weakness, speech difficulty, it's time to call 911. So the next 4 slides just basically go over how immense the brain is in terms of what different areas control. So the next 4 slides are basically just for educational purposes aside from strokes, and just again illustrating how the brain is interconnected and what areas control what. So this red area is the front of the brain that we're looking at from the side. So say for example you were looking at the side of my head, this is what you would see in my brain if you took out the skull. So this front area which is closest to the eyes. So pretend the eyes are right here. This area controls motor, concentration, planning, speech, smell. This yellow portion up here controls sensations, different other sensations. This green area, which is on the side, controls hearing, language, reading, facial recognition as well. The back of the brain right here controls more vision. And this bottom part right here in blue, it controls coordination. So depending on which area is affected, those are the type of symptoms that the individual will express. So for example, if an individual had a stroke anywhere in this red area, they may have deficits involving these issues right here. If they had it in the back portion of the brain, then they may have just vision issues. So again, it depends on where the stroke occurs in order to understand what symptoms they may be experiencing. So the brain is actually controlled by three main blood vessels or arteries, and we're not going to go into the names of them, but the three areas, one artery controls this yellow portion, one artery controls this red portion, and another artery controls this blue portion. So this is basically looking at the brain as we were in the last image. This image is basically, if you cut the brain in half, you're looking into the inside of the brain. So that's this view right here. And to make it a little bit more interesting is that the brain is actually has different areas that control different parts of the body as well. So for example, if a stroke were to occur on this side of the brain, or right here for example, it would basically control the facial issues, and there will be facial problems in this individual. If it's more up here, it would be more the shoulder or the elbow that would be affected. If it's in the center up here, it may be the foot or the knee or the lower leg that's affected. So it depends on where the stroke occurs to what symptoms, again, that this individual will be experiencing. And this is basically looking at the brain. See, as you can see here, this just means you're looking at the front way of the brain, and it just takes like a section of the brain out like this. And again, the left and right brain control different functions as well. The left is more mathematical, logical, more factual in nature. The right side of the brain is more the creative, artsy, and holistic thinking, imaginative side of the brain. So again, it depends on which side of the brain is affected to illustrate what symptoms an individual would be expressing. And what's cool is that the left side of the brain actually controls the right side of the body. The right side of the brain controls the left side of the body in general. So let's get back to what a stroke and more about stroke issues. So I just want you to take a second and try and remember what the acronym FAST stands for. Okay, so I'll give you a couple seconds to think about it. So F stands for face, so there'll be some asymmetry in the face. A stands for arm weakness, so if you ask the person to lift both arms up, one side may be weaker than the other. S stands for speech difficulty or slurring of their speech. And T stands for it's time to call 911. So it's very, very important to drum this in and to understand and be able to recognize what a stroke looks like. So these individuals who are possibly having a stroke, they would most likely come to the hospital for management. And what we would do there is do a couple of scans to make sure what type of stroke it could be, if it's a bleeding stroke or if it's one that is caused by a lack of blood flow, like a clot that may be present. So they may do a couple scans or just initially a CT scan to make sure that there's no issues going on there. They may do some blood tests as well. They may test the rhythmic activity of the heart via an EKG to see the electrical activity of the heart and make sure there's no issues there. They may do some genetic tests. They may check the spine, which is a lumbar puncture, which tests the fluid within the spine to make sure there's no bleeding in there, as it's connected with the brain area. And They may do an ultrasound as well too to find out if there's a clot anywhere in the neck, legs, heart that may predispose of why this stroke occurred. And time is very crucial. Specifically in the fast mnemonic, time is essential. And the doctor will definitely ask about this. When did these symptoms start? Because according to the onset of symptoms, if the treatment is given within a very narrow time frame, as we'll see in the next few slides, it can actually reverse the clot that is formed there. So treatment. So if the tissue is damaged, is in this case right here, where there's a clot or something that completely blocks the flow of blood to the tissue, we would initiate a clot breaker to these individuals within this 3 hour, ideally 3 hours, but also it can be extended to 4.5 hours time frame, because what that can do is break up the clot and even possibly reverse the symptoms of the stroke that this individual is presenting with. Our main goals in this type of stroke is to make sure the patient can breathe, also control their blood pressure if it's excessively elevated, and again give the clot breaker if needed. There are certain contraindications or times when clot breakers would not be allowed to be given, so that would be assessed by the physician in charge of the patient's care. The patient may also be on blood thinners as well to prevent another stroke, and also rehabilitation is part of the protocol. We'll talk a little about what a rehabilitation is in a few seconds. Let's talk about a brain bleed. So the main goal, if it's bleeding, as in this case where there was a bleb of the blood vessel here that popped open, right? So that bursted and led to bleeding in the brain. Our goals are to lower the blood pressure and prevent seizures, which are basically abnormal electrical activity in the brain, and also prevent swelling of the brain. And treatment modalities for this will be rehabilitation. If the blood is large enough, perhaps to remove the blood or even close off the blood vessel that's bleeding. We may give them medications to prevent these seizures and swelling and to lower their blood pressure as well. So what's rehabilitation? It basically consists of physical therapy or helping the individual being able to move again and walk, for example, as well as occupational therapy to help with activities of daily living, such as speaking, eating, swallowing, or whatnot. Speech therapy is also part of it. Psychological therapy, because a lot of individuals who do experience a stroke tend to be very depressed and sad. So trying to provide them that psychological support is very important. And perhaps even yoga may help. So blood pressure control is important, as we mentioned, particularly for the bleeding stroke. For the one that has lack of blood flow, it's only if they have a severe amount of significantly elevated blood pressure that we would want to treat. The reason why we treat those that have a bleeding stroke is because we want to lower the blood pressure, because if the blood pressure is still so high, the blood vessel may not have enough time to heal itself because of the high pressure. That's why you want to lower the blood pressure so that it can heal it on its own, so that the bleeding can stop. So prevention is very key for stroke. Again, blood pressure control is very key to the recommended targets, as we discussed in the blood pressure and hypertension seminar, as well as to control the individual's diabetes and their blood sugar to targets, as well as controlling the individual's cholesterol if it's elevated. There is an artery or a blood vessel in the neck that tends to be clogged with a clot that may send off clots to different areas in the brain that has direct connection with the brain. So sometimes they'll do an ultrasound of this area to ensure that there's no clot that has formed here. If it's a significant amount of a clot, they may do surgery to remove the clot as well. Stopping smoking is very important. The risk of having a stroke actually decreases to normal within 2 to 5 years of quitting smoking. So it's very There's no time like the present to quit smoking. Again, physical activity and diet. Similarly to the high blood pressure seminar that we talked about, the DASH diet would be very important to incorporate here, such as fruits, vegetables, whole grain. Whole grains is important to add. Again, lowering the salt, the fats, and the sweets. Perhaps increasing omega-3 fatty acids as well. Again, the side effect of taking it in too much amount can lead to increased bleeding risks. So that's why we want to try and be aware of that. And just as a fun fact here is that pregnant women should basically avoid those fish that have high mercury. And these are some examples here of shark, tuna, and swordfish. But there are other ones out there as well that they should avoid. Treating an abnormal heart rhythm called atrial fibrillation is very important. And this is very common in elderly patients. And the reason what we do in these individuals is put them on a blood thinner, because an abnormal activity of the heart, it doesn't beat in a synchrony as a normal heart does. So since it beats abnormally or irregularly, it actually increases the risk of forming a clot in the heart, and that clot can break off and travel to the brain and cause a stroke. That's why we want to treat these individuals. Usually we treat them with Coumadin or warfarin. And one little tidbit of information here is that if you're on Coumadin or warfarin, you want to try and avoid vitamin K rich foods, as it would counteract the mechanism of action of Coumadin or warfarin itself. So vitamin K rich foods are like certain dark green vegetables that are available. Perhaps increasing antioxidants may help. Aspirin may help, but again, aspirin has a slew of side effects such as kidney damage and also increased risk of bleeding. And another blood thinning medication may be indicated for preventative strategies. So what alternative medicine is available for prevention of stroke? One side note here I would like to mention first is that a lot of these herbs actually have interactions with certain medications. So it's very important to be able to understand which ones have that interaction, so that you're not countering certain medications that you're taking on a regular basis. So garlic actually may help prevent plaque and destroy clots. These questionable ones here, they may help, they may not, but studies have not really come to a consensus as to their effects. Turmeric actually helps lower the bad cholesterol, or the LDL, in the body. One side effect of having too much turmeric, however, would be that it would thin the blood. Also, acupuncture is shown to be very helpful. And acupuncture is just right here that a technician basically puts these fine needles in specific areas of the body that promotes healing. And it's actually shown from the National Institute of Health. They recommend this therapy as an alternative to stroke rehabilitation, as we talked about, to get nerves firing and muscles being used so that these people can get their movement back. Okay, so let's talk about the prognosis of stroke. There may be some residual effects of having a stroke, in particular if it's surpassing that time frame of 3 to 4.5 hours. So certain effects can be seizures or abnormal electrical activity of the brain, paralysis or loss of movement of one side of the body, for example, maybe some cognitive or thought issues, of memory issues, speech issues, emotional issues, problems with daily activities of living, such as eating, swallowing, moving around, using the bathroom, etc. May lead to pain as well too. Recovery can be complete or partial. So if they're complete recovery, that tends to happen in individuals who come within that time frame of 3 hours to 4.5 hours. However, some individuals can have partial recovery. Most resolve usually within the first 3 months, but improvements can continue even surpassing a year or two. So it's important that if this does occur, not to lose hope and to always keep at it, and with the physical therapy and the rehabilitation, as that may give a new life on movement. So let's summarize. A healthy diet and exercise are the best ways to treat and prevent high blood pressure, stroke, diabetes, high blood cholesterol, and more. So this is the exact same thing I've taken out of my blood pressure presentation because it's very, very important for this as well too. It's important again to monitor and control blood pressure, diabetes, and cholesterol regularly within 3 to 6 months with the family physician. Strokes are basically damage that occur to the brain due to either bleeding because of a popped blood vessel or a decrease in blood flow, as in a clot, for example. And it's important to identify a stroke via the fast mnemonic. So F stands for your face, okay? So facial asymmetry. So one side of the face goes up while the other side does not work as well if you ask the person to smile. A stands for arm weakness. S stands for slurring of the speech or speech problems. T stands for it's time to call 911. So here are my references of my pictures and the information that I got in making this presentation. And I would like to say thank you. And please like and subscribe to my YouTube channel. As well as if you have any questions, please address them below and I'll try to get back to them as soon as possible. Thank you so much and have a wonderful day.